We're here at Faith Regional and getting ready to learn more about cervical cancer. Let's talk to the doctors who treat it. I'm joined by Dr. Lynnea Stines, an obstetrician and gynecologist with Faith Regional Physician Services. Our topic is cervical cancer, and let's begin by talking about screenings. What can you expect with those?
Yes. Screening for cervical cancer is generally done at the well woman exam. We generally start the pap smears at age 21 unless there is a concern sooner. But at least at age 21 we do the pap smear testing. And depending on your age and your history, sometimes we also add the HPV testing as well, which is the human papillomavirus. And if there's any concerns with either one of those tests, then we generally bring you back to the office to discuss.
What are some of the symptoms or the signs of cervical cancer that people should be on the lookout?
Unfortunately, cervical cancer is generally asymptomatic when a person is diagnosed. So they generally don't even know anything's wrong most commonly, which is why it's so important to be screened. However, if a woman does have symptoms of cervical cancer, it can be irregular or heavy bleeding or bleeding after intimacy. Other times, some women will have some abnormal discharge as well.
What are some of the preventative steps that can be taken to prevent having to deal with this?
We have really great options now. One of them is the HPV vaccine, that human papillomavirus vaccine, that has been approved, which can help prevent women from getting the HPV strain, which then go on to cause cervical cancer. And then otherwise, the pap smear is a wonderful test that we have that helps screen women for cervical cancer.
As far as treatments, what can be done to help out?
So if a woman is diagnosed with cervical cancer, they are generally referred on to a gynecologist-oncologist, and there's many different treatment options, whether that be surgery, chemo, or radiation if needed.
You're still trying to prevent as much as possible, so when should people get screened?
Women should be screened for cervical cancer at least at age 21, if not sooner, like I said, if concerns arise. And then at age 21, it's generally every couple of years, depending on their history, up until generally in women in their mid to late 60s can then discuss whether or not they want to continue to have cervical cancer screening done or not with their gynecologist.
Dr. Stines, thanks so much for lending your expertise.
Thank you so much.